All set? All right. I will call to order the HHS meeting of October 19th. Roll call, please.
Chair Renahan?
Here.
Vice Chair Swarzy?
Here.
Member Selman? Here. Member Chaplin?
Here.
Member Desart? Here. Member LaPlante?
Here. All present. Great. And in terms of public comment, I see Barb Haniak has signed in from DuPage Foundation. And as far as my report, all I wanted to say was welcome Barb here today. We're going to hear from her later on. She's from DuPage Foundation. And any questions you all might have regarding community services allocations. So thank you, Kate. I'll take a motion to approve the minutes of October 5th.
So moved. Second.
All in favor?
Aye.
Any opposed? Those are passed. I'll take a motion to approve FIR 459 resolution acceptance appropriation of HUD 2020 premium repair plan grant $149,787. Second. Questions or comments? All in favor?
Aye.
That was approved. Motion to approve FIR 46021 resolution acceptance of an extension of giving DuPage staffing grant FY 21.
So moved.
November 30th, 2021 to November 30th, 2022.
Second.
Any questions or comments on this item? All in favor?
Aye.
Any opposed? That is approved. And then we've kind of got some funny stuff going on the next one, but I will take a motion to approve HHSR 47121 resolution to create transfer funds from general government to U.S. Treasury Emergency Rental Assistance Fund in the amount of $27,357,319.80.
Second.
All right, and questions, comments? I just kind of want to fill in a little bit of the gaps here. Mary had told me.
There's also need to be
I'm getting
slightly
there.
amended. Okay.
I'm getting there. So apparently, the way this is like an accounting thing that we just need to, the money, we got the federal money and we need to put it in a certain bucket. And apparently you cannot have cents onto it. So we are just I'm going to move to amend the resolution HHSR 47121 authorization to create and transfer funds from general government to U.S. Treasury Emergency Rental Fund in the amount I previously stated to be amended to the amount of $27,357,321. Is there a second?
Second. Sorry, 21 or 20?
21.
How?
I thought the same thing. Yes,
Okay.
it's 20. I am told 21.
You've got your help finance.
Hi, it's rounded that way because the money is in different categories, like there'll be payroll and then there might be commodities, and each one of those has to be rounded off.
I see.
So
Okay.
that's why, all right.
Okay, so we did have a motion. We do have a second. Yes. All right, all in favor?
Aye.
Any opposed? All right. So the amendment passes. So moving on, we will now vote on the main motion, which is a resolution to create and transfer funds as amended. Is there any further discussion? Hearing none, all in favor, say aye.
Aye.
Any opposed? All right, the motion carries. Back on track. I'll take a motion to approve HHSR 47221 resolution appropriation of U.S. Treasury Emergency Rental Assistance Program in the amount of $27,357,321. Right? I'm sorry, who was the second?
No second.
Oh,
sorry, second.
Second,
Okay,
thank you.
sorry.
Member Solomon, all in favor, say aye.
Aye.
Any opposed? All right, that passes. Kind of have something going very similar on the next item that we just did at C. I'll take a motion to approve HHSR 46921 resolution authorization to transfer funds from general government to U.S. Treasury Emergency Rental Assistance Fund in the amount of $10,672,015.20.
Second.
All right, all in favor?
Aye.
All right, so I'm sorry.
I need a motion to amend it.
All right, now I have to go to the motion amend. I was so doing it right there for a minute. All right, I move to amend, same thing. This is going to the penny situation. I move to amend resolution HHSR 46921 authorization to transfer funds from general government to U.S. Treasury Emergency Rental Assistance Fund in the amount of, as what I previously said, to be amended to $10,672,016. Is there a second?
Second.
Thank you. Is there any discussion on this amendment? All right, hearing none. All in favor, say aye.
Aye.
Any opposed? The motion carries. Moving on to the main motion, which is a resolution to transfer funds as amended. Is there any further discussion? Hearing none, all in favor say aye.
Aye.
Any opposed? All right, motion carries. That was fun. Take a motion to approve change order HHSP 318A-21 amendment to resolution HHSP 31821.
Is actually F.
6F, yeah.
Okay. Oh, I'm sorry. I was so excited. Take a motion to approve HHSR 46821, resolution appropriation U.S. Treasury Emergency Rental Assistance Program, ERA 2, in the amount of $10,000,016,016. All right, thank you. All in favor, say aye.
Aye.
Any opposed? That passes. All right, now moving on to the change order, I'll take a motion to approve HHSP 318A21, amendment appropriation HHSP 31821 to Page Federation Human Services Reform. This is to provide American Sign Language services, increasing the amount $8,050.
Second.
All right, we have a motion. We have a second. All in favor, say aye.
Aye.
Any opposed? That passes. I'll take a motion to approve HHSR 46121 resolution recommendation for approval of partial release deed and partial release of regulatory and land use restriction between DuPage County and Prairie Green Habitat Prairie Green subdivision, allowing the Illinois DOT to improve the intersection of Illinois 56 and Illinois 53 in DuPage County, and authorizing Director of Community Services to execute said documents.
Second.
All right, thank you. Questions or comments on this item? All right, all in favor?
Aye.
Any opposed? That passes. We have another CDC request. I'll take a motion to approve HHSR 46221, recommendation for approval of a fourth modification CDBG with Kids Above All, formerly known as Child Serve, Project CD 1912, Island Downish Road Group Home Rehabilitation, reducing scope of work and reducing funding by $28,550.44.
Second.
All right, we have a motion. We have a second. Any questions or comments on this item? All in favor?
Aye.
Any opposed? That is passed. For our last CDC request, I'll take a motion to approve HHSR 46321, recommendation for approval of third modification, second time extension, CDBG
So moved.
with Little City
Second.
Foundation, renovation for 2 Hanover Park DILAs, project number CD 20-03, extending project completion date to December 31st, 2021. All right, we have a motion. We have a second. Questions, comments? All in favor?
Aye.
Any opposed? That is approved. Moving on to the DuPage Care Center. I'll take a motion to approve HHSR 46421. This is a DuPage Care Center rate increase, increasing per patient day charges. Last fixed by resolution at HHSR 58220 from $330 per day to $345 per day for custodial care, $359 up to $373 per day for Alzheimer's special care, and $570 to $593 for post-acute care effective December 1st, 2021.
Second.
Right, we have a motion. We have a second. Yes, Member Garcia.
Yeah, I was just wondering how we compare how our room rates compare to other care centers in the area. I'm just wondering.
Yes, I'm here. This is Janelle. I can certainly speak to that. So our analysis shows for a standard custodial in the market, anywhere from $225 to $401. So our rates fall below the mid on that. But keep in mind that other organizations bill things differently. Ours is all inclusive, and some facilities will charge for incontinence products, or charge for wound products, or charge for medication separately. So we are below the mid for the market. We do a 3 to 4% increase. The last few years has been 4%, and our others in the market are doing anywhere from 4 to 6% this year. But also keep in mind that our private pay people are 99% of the time come to our building knowing that they're going to need Medicaid services. So it's a spend down. So if they run out of money where they're not asked to move out, we already planned for them to be moved into a Medicaid bed.
Fantastic. Thank you, Janelle.
So Vice Chair.
I think Dawn had her hand up first.
Okay, Member Sark.
Thank you, Janelle. My question is, I see that the rates were raised about a year ago, right around this time, October 27th of 2020. Are these rates increased every year?
They are. We have to do a 30-day notice. Yes.
All right, thank you.
Thank you. Thank you, Janelle. So with these rate increases, are they figured into your next year's budget as far as your revenue? Because obviously that's
Absolutely, they are. Yes.
okay, thank you.
And I just want to reiterate, I mean, the private pay over at the care center is a very small portion of really the people over there. So I think it's important to ask questions. Thank you all for your, being involved. All right, so we have a motion, you have a second. Do any other questions, comments? All right, all in favor?
Aye.
Any opposed? That is passed. Motion to approve consent item, Medical and Family Services sub-grantee contract extending time through
So
December 15, 2021 to complete expensive funds. All right, we have a motion, is there a second? Member Solomon, thank you. Questions, comments? All in favor?
Aye.
Aye. Any opposed? All right, that is approved. One more consent item, I'll take a motion to approve decrease in closed DuPage Federation on Human Services Reform in the amount of $31,337.77. Contract expired. All right, we have a motion and a second. All right, questions, comments, all in favor?
Aye.
Any opposed? All right, that is approved as well. We have no residency waivers. Janelle, DuPage Care Center update.
Yes, good morning. Thank you. I want to update you on our COVID outbreak that we've had over the past few weeks. We ended up having over 30 residents that have been positive and 3 staff. We now have 6 residents on the COVID unit that will come out by Friday. We have 2 other units that are still on quarantine as a result of those people that have been previously positive. I'm sorry, 3, but 2 of them will also decrease their quarantine status on Friday. You may recollect that we were able to create 4 negative pressure rooms, which are really beneficial in dealing with anyone with a respiratory like a tuberculosis or now like a COVID. So those rooms were completed earlier this year, and we had already had our established COVID unit on the south side of this unit, and these negative pressure rooms were on the north side. So now that we're coming to lower numbers and those rooms are already and functioning, we are going to flip and move our COVID unit to include those 4 negative pressure rooms. So Annabelle, our director of nursing, when these individuals move out, we're going to do a whole flip, a whole deep cleaning, a whole fogging, a whole, the whole kit and caboodle, so to speak. And then we'll be incorporating those negative pressure rooms into the COVID unit. And that is optimal. So those people that get nebulizer treatments or BiPAP or CPAP, those are all treated differently from a COVID isolation because of the particulate matter that can be expelled via a BiPAP or a nebulizer treatment. So thank you to you all for helping us get those 4 rooms. We're very excited to have them. That is an unusual thing in a long-term care facility. So we're very appreciative to have that. Let's see, what else did I have? Just as a brief update, we have we're moving forward with our union bargaining, and we have 2 sessions this week. So just to keep you in the loop somewhat on where that stands. Any questions for me?
Member Solomon?
Thanks, Janelle. I think Member Renahan maybe updated us during the last meeting that your boosters program, you were able to get some success. Could you just update us on that?
Yes, we are scheduled. We have 2 vendors that we're looking at, and we believe we have one vendor that can do it even sooner. So we're working with them to get it scheduled prior to November 9th.
And that they'd be able to give you all the 650 doses you need?
Yes, yes,
Awesome.
yes.
Congrats. Thank you.
Yes, thank you.
Right, any
So
other-
we've been able, one of the things, this last outbreak was really 1 unit. And we have 8, we have 7 up and running. So the fact that it was contained to the 1 unit really is a credit to all the staff and their practices. This variant, we really feel it's the variant. The way it spreads and how quickly it spreads, as I mentioned before, Annabelle's testing people twice a day. And one time they're negative and the next time they're positive. So it's a really a huge credit to all the staff in all of their efforts to contain that. So let's everyone pray that we don't have a case pop up somewhere else. But it's just been remarkable, and I can't thank them enough.
Any other comments on the plan?
I'm just curious, Janelle, do you know how many of those 30 residents, how many were vaccinated?
I believe all of our residents were vaccinated that were positive.
Wow, so these were all breakthrough infections.
Correct.
Okay, and how about for the 3 staff members?
2 were unvaccinated, 1 was vaccinated, I believe.
Okay. Okay, thank you.
Yes.
Great. Well, thank you, Janelle, for all the hard work you all are doing over there every single day. We appreciate it. So,
Thank you.
all right, moving to community services update, Mary Keating.
Good morning. I want to thank you all for the really good conversation we had, both finance and board, last week about the establishment of the ARPA grant program. I wanted to spend a little time this morning diving a little deeper into it. And I've asked Barb Sukaniak, who is the Vice President of Programs for DuPage Foundation, to kind of tag team with me. We're going to start out. Barb's going to give a little overview of the foundation, sort of some of the COVID response work that they've already done, a little bit about how we envision a partnership. Then I want to spend a little bit more time talking about the Treasury reporting that we need to do, because I think it's really important to understand our requirements from Treasury that we'll need to be, passing down to the Federation, and also how we'll need to be really focusing our efforts with these grants. And then I'd like to wrap up with some further discussion about priorities and what we really see the need being that we want to address in the grant program, so that I can gather that information. We can really start hammering out the agreement that will then obviously eventually come back to HHS and the full board. So let me start off with Barb.
Well, good morning. Thank you for having me here today. I think a lot of you know the foundation and what we do. We are celebrating 35 years.
Sorry, Barb, if you can stand over there, that
That
would.
way everybody will see you.
Yeah. So we're celebrating 35 years as DuPage County's philanthropic leader. And basically we work with donors who want to have impactful support in the community. And then we connect them to the organizations that are doing the work or addressing the most critical issues in the community. The overarching goal is that we want to raise the quality of life in DuPage County. We're very excited to work with the county on this program. And we do feel that we're uniquely positioned to do so. We have extensive experience working in grant making. I've been with the foundation for 13 years, and we have a community needs grant program in which we have a grant committee. It's a volunteer committee that reviews about 100 grant applications each year. And we distribute grants throughout the county to organizations working in the area of health and human services, education, arts and culture, animal welfare, and environment. And then last year we did have a COVID response fund. And through that process, we reviewed yet another volunteer committee that reviewed 200 applications, and we distributed 90 grants to 96 organizations. And we also worked very closely with DuPage County. We were grateful to receive $434,000 from the CARES funds. $131,000 of that was for emergency assistance, PPE, sanitation supplies, technology. And then later in the year, we went back to the county and asked for $303,000 to support arts organizations. And we were able to distribute those. So we have worked closely with the county on that. I am also on the DuPage County Homeless Continuum of Care. I've been on the leadership committee for quite a few years and on the rank and review committee to review the HUD grants. So we do have partnerships. I've worked with Mary for a long time and with other community services staff. Through the COVID fund, I want to say that we raised $1,755,000 and distributed that over the course of 15 months. So once we hammer out this agreement and the expectations are known on both sides, we will establish at the foundation an overarching committee that will include 4 strategic areas. It would be finance, communications, advancement, and of course, programs. Finance, we want to make sure we're managing the funds appropriately and that we're doing the right reporting. Communications, we will work with Joan because we want to make sure that the common messaging is getting out to the community. We're saying the same thing And really important, we are saying that. We are letting the community know that the county is investing these funds in the community and how it's being used. I think we really need to do that and really show this partnership with advancement. While we're doing these grants, we want to be, our advancement team is going to be out there trying to raise private dollars so that when the ARPA funds go away, that perhaps we'll have those funds available to sustain some of the most promising practices that we identify through this process. And then, of course, programs. We will be establishing a grant committee that will be establishing the guidelines, establishing the processes, determining what outcomes we want to have, and obviously reviewing the applications. And we will probably put together the group of people that have sat on one of our grant committees or have been very involved with the foundation. And then finally, we would expect that the Director of Community Services, Mary, would be on that committee. So finally, I just want to thank all of you for having the vision and for advocating to use some of these ARPA funds to give to the nonprofit organizations that are really having, are serving those that are most negatively impacted by COVID. This is a great opportunity, one, to have long-term impact and really build capacity in the community. So I'm very excited to move forward. So happy to answer any questions.
Go ahead. Thank you. I agree that I think this is a really innovative idea that can have long-term impact, which I know is so impactful for grants made in this community space. I'm curious about, for the advancement team, if they raise dollars, what is the goal for those funds? Would they be endowed? Would they be expendable?
Most of the funds that we raised are endowed.
Okay, so would the goal, would it be a perpetuity that would go to these same items, or does?
Well, it's hard to say. We're going to be using, right now, we are going to be implementing grants, and what we're learning from that, what is the most promising practice? What really had the greatest impact?
So
and as a foundation, that's what we would want to, fund. And we're using this opportunity to talk with donors, to get them to want to invest in the foundation to support these really important issues.
So I'm sorry, the endowment funds, would they stay under the control of the parameters of this goal? Or
No,
would
it
they
would
go
stay with the
towards
foundation. It would be under the DuPage
Okay.
Foundation. So it's a separate thing. It's just one of the things we'll be doing while we're doing this. So it's very separate.
Okay.
But
No, I think that's a great idea to start raising those funds so that, you won't have the ARPA funds, but it's a program that you can sustain
Yes.
then through yourself. I think that's
Yes.
a good vision, because I think we're going to see these, we're going to have these needs for a long time. And, you guys, I've been out to some nonprofits and some that have received grants, so you guys know how to do it. So I'm very excited when, we talked about this. I think it's going to be a great program, and I do like the private public partnership. I think it's really it's a way to go. So thank you. We have to see how we come up with our, one thing that I did, a resident mentioned to me was, maybe providing loans to smaller nonprofits, like for nonprofits that have a budget of maybe under 200,000, where they service, community members, but they're not quite as large as other nonprofits, but they really do provide a good service. A lot of those are minority people that may not feel comfortable going to a bigger nonprofit, but this nonprofit happens to be right in their neighborhood and they're comfortable going there. So just something that for us to talk about is our committee.
and that's something through our community needs grant program. Those are the kinds of programs we do support.
Okay, great.
So
Good, perfect.
we're already
Yes,
doing
all
some of
right,
that.
great. Well, good, thank you.
Yes, member Sykes.
Thank you. I'm very excited about the program as well, very excited. My only question last week was about the $600,000 fee to administer this. Are you gonna have to hire new people or how will that 600,000 be spent?
Most definitely, we're going to have to hire people. This isn't a very intensive process. I look at this a little bit, a lot different than our community needs. We're giving a lot of grants out. We've had a lot of relationships with these organizations. They're one-year grants. After you have your discussion on what those priorities are, I anticipate in previous conversations that these might be multi-year grants. These are very different, and these are it has to, and Mary's going to talk about that, but they have to be evidence-based. We have to do all of the financials. This isn't, oh, this looks like a good thing, let's fund it. It takes a significant amount of work to go through this, go through the financials, go through the evaluation. We have expenses on our side. We have to do a single audit because we're going to be accepting governmental funds. So it's pretty involved.
Any other questions? Yeah, I just want to say too, I think this is going to be a great partnership. I love that you're being proactive and trying to leverage what we're giving to take it to the next level. I think that really, right off the bat, sends a very positive message. So.
And we want the community to know that. We want the community to see the county working with the foundation. We want it to be out there.
Yeah.
Because I think a lot of times these funds, people don't really realize how impactful they are. And they don't even realize the need is out there. I mean, mental health right now, and I'll talk a little bit more about that, but there's a lot of need in this community and people don't really know how to. So this is a great opportunity all the way around.
Should we bring you in now, Mary?
Yeah, so this kind of goes to a couple of the questions that came up. First about sort of diversity and equity and working with those populations, and also about what is the administrative expectation. And so one of the things I came across last week is the template for Treasury on how the county has to report back to Treasury. And keeping in mind, this is for the entire ARPA program. This isn't just ours, but I think the grant program really speaks to so many of the things that we do have an obligation to report on to. So I'm going to take just a second to read through some of the things that we have to report back to Treasury on. I think it's really important to keep in mind that when you're running a grant program, you have to begin with the end in mind. And so there's going to be a tremendous amount of upfront work to help us create a program that will allow us to report successfully on the things that Treasury expects of us. So promoting equitable outcomes, each annual report must provide an update using qualitative or quantitative data on how the recipient's approach achieved or promoted equitable outcomes or progressed against equity goals during the performance period. Describe how your jurisdiction's planned or current use of funds prioritizes economic and racial equality as a goal. Name specific targets intended to produce meaningful equity results at scale, and articulates a strategy to achieve those targets. Again, it's a lot of upfront work to figure out who are we going to fund and for what purpose to achieve those goals. On community engagement, how is your jurisdiction planned or current use of funds incorporates written, oral, and other forms of input that capture diverse feedback from constituents, community-based organizations, and the community. Use of evidence. Recipients should describe their overall approach for using evidence and evaluation, including how a learning agenda, either narrowly focused or broadly focused on the recipient's policy agenda, could support their overarching evaluation efforts in order to create evidence building strategy for their jurisdiction. It's exactly what Barb was talking about. How do we figure out what's successful so that we know how we can get that information out to the community and know what we should be investing in going forward. There's a project inventory where you need to have very specific performance measures, including outputs and outcomes for every single project. So again, I don't want to read the whole thing, but it's a very specific expectations from Treasury on what we will accomplish with these funds. So we're not just talking about financial tracking. We're talking about really significant goal setting, strategy setting, and measurement and evaluation of these programs. In terms of priorities, I think, we've talked a little bit about it. Keeping in mind that we're talking about like a 5-year horizon here. And so, what do we think are absolutely going to be the needs moving forward, at least on a, sort of the beginning. Did we lose?
No, we didn't lose quorum,
great. But think food, I think, I think we kind of look at Maslow's hierarchy of needs, food and shelter being the most prominent. Food insecurity is absolutely something the food pantries continue to see demand for. Housing insecurity, there is a ton of rental assistance money out there through the IDA program. But when we're talking about a 5-year horizon, that's most likely to go away. The majority of it will be gone. in 2022. And so I think it's, and that's not, rent assistance isn't the only kinds of support that people need in terms of maintaining housing, their housing. So I think that's, to me, a very obvious choice. Then behavioral health and substance abuse treatment. I mean, that really comes up over and over again. And frankly, it's sort of an underpinning of all the other, individuals with behavioral health issues or substance abuse disorder. It's going to impact their economic viability, their other mental health, their, the family stability. And so to me, those are really, I believe, where we should really narrow and really target. It's really important to build that in early on so that when the foundation does solicit for applications, it's very clear from the beginning what we will and what we won't fund. And so that's what I would recommend including in the guidelines that we develop for the foundation. Barb and the foundation has been doing some significant, they're calling it exploration, with behavioral health providers in the community to figure out what exactly is needed. So again, speaking to that Treasury reporting, what kind of community engagement are we doing around this? They're absolutely in that process right now, which works out quite nicely.
I saw Vice Chair Schwartz.
Thank you, Mary, and thank you, Barb. I'm a big believer in the mental health and especially the substance abuse portion of this. And both of you have given a lot of explanation on the steps that need to be taken to achieve that. And so I'm probably jumping the gun by asking this, but especially when it comes to mental health, food is easy as far as being able to figure out who the charitable entities are, so forth and so on. What does a mental health and substance abuse program look like if we're putting, millions of dollars into this over 5 years? I mean, can you help me out? I know you said you've done some exploration already with this. And then after you answer, then I have one more thing to add to that.
So we did, as Mary described it, an exploration. In July, we brought together the nonprofit organizations that provide some sort of mental health program, trying to identify what were some of those themes over the course of 3, we call them roundtable discussions. And staffing issues are huge. We just don't have enough mental health providers, all the way from psychiatrists, psychologists, social workers. So you could put hundreds of thousands of dollars. We have to build that staffing. I don't know how that's a hard one there, but it's a long term. Can you invest in something? And that to me is what the organizations need to provide. What is your vision and what are some of those scientifically supported practices, evidence-based? What can you do? The other issue is youth. And what we heard is these after-school programs, for example, kids that go to those after-school programs. Not everybody is into sports. Thank you. They're not all into sports. Some are into music, some are into art. There's a lot of bullying going on, and they're finding that those mentorship programs and just having some place to go to be a part of something doesn't sound really like a big deal, but that really does resonate, and there's some evidence that is successful. The other issue we're seeing is the language. A lot of people in DuPage County don't speak English, and the ones that need the services, they can't access those because they don't understand. So how do you address that? So those are 3 themes that really rose to the top. And we also heard that there's a lot of misunderstanding of who's doing what in the community. So
thank you. That's a good start.
Yeah.
So I'm going to get a little bit more specific one more time. One of the things that I'm a big believer in, especially when it comes to substance abuse, is the education portion of it. But in my opinion, the mandatory education of it, which where are you going to find that? You're only going to find that in the school setting. So, most kids get their drug education in 5th grade during the DARE program, if their school district even provides that. And then even that is divided amongst many different things, not necessarily just opioids. What is our ability to use some of this money to provide school districts with specific opioid education for their students?
Yes.
So
I mean,
I don't think there's anything that would preclude a school district from applying.
Okay.
I think what we really have to be careful about is so as we've talked, sort of the vision I think we have of the process is that we'll sort of announce this, this opportunity. And then the organizations have to go back and really dig, because this has to be evidence-based. So it can't be, I mean, absolutely no disrespect by saying this, but it can't be, well, I'm a big believer in this type of program, or we believe in this type of program. What is the evidence tell us about what is the most effective? So who else has studied these models and has quantifiable and qualitative and quantitative data that says this is the approach that works?
What if that doesn't exist?
If that doesn't exist, then they can propose something, but it has to have a very specific evaluation component. Who is your evaluator? What's your time frame for evaluation? So Treasury is very specific on that. In terms of process, what we've talked about is giving the organizations who intend to apply a pretty good span of time, be it 2 months or 3 months from the time we announce it to the time that the applications are due, to really do their due diligence and say, we've really researched, and this is the program that we really think we can implement here, or here's the thing, here's this new approach we'd like to take, here's why we want to take this approach, and here's what our process is for the evaluation of that.
Thank you.
So there are organizations that actually go into schools with different programs. So an exciting possibility could be that there's an organization out here that has a program. Hard thing is getting into the schools.
Yeah.
That has been the biggest pushback that we've seen with youth mental health, is the schools just don't have time. They don't have the staff.
Yeah.
So I'm sure there are organizations working out here that could put together a fabulous program. And there might be one out there in the United States that's already being done, but it's getting into the schools.
Thank you.
And
Yeah.
that does happen. But it's
And I
slow.
will be
It's a-
working on it from that end as well.
But it would be slow. We do it with our Right Early DuPage initiative. We've done it with early childhood. It is hard work, but you know what? We started and we're in 6 communities. And now it's been, 9 years, but over time, the other communities are saying like, wow, the community is working together. We want some of these resources. And I think that's what's so exciting about this money is we can invest. And as they see it's effective, other communities want to adopt.
Thank you.
Raise your hand up, Member Solomon.
I'm wondering if one area we might be able to provide, or at least explore, is support for working parents. I think that's one that we've really noticed has been a struggle. We've had board members who've had challenges with their childcare, and I always feel like if we have challenges, the whole county must. And it's particularly something that's affected women reentering the workplace. I think the most recent stat I saw was 30% of those who've left the workplace are women, and they're not coming back because the schools aren't available yet. I think it might sort of be similar to Member Shoresy's, where there might be a lot of solutions, but whether or not we have evidence-based support to say that's a good solution.
There's also a fair amount of ARPA funding out there for childcare supports, both for the workforce and for the consumers.
Okay.
So and not to say that that's not something that we would look at supporting, but I would absolutely want to make sure that we wouldn't be duplicating something that's already out there.
I wonder if we could get some better information on that through this committee and advertise that, because I don't know that folks know there's things available, because I think what we've heard from like WorkNet DuPage, for instance, is they don't even get to that.
Right.
Like they're not going out and applying for jobs, because how are you going to do that if you've got
Right.
kids home and no one's there to watch them?
Right.
So I think if there's stuff available, we can figure out how to get that information out there.
I think a lot of that's being administered through the state, though. I mean, the governor's done a huge program for childcare.
But I can find out more information.
But
Yeah, so I think it's not.
more
getting
info
the
is good.
Yeah.
We like info.
Awesome. Thank you.
All right, Member Garcia?
Yeah, and going back to Member Schwarzy's, I'm a big supporter in the drug program at school too, but I also believe that mental health is sometimes what leads to this, because of course they're trying to self-medicate. And I agree that I think what some of the issues are is staffing in some of these other programs. So I that's where I would feel that we would be concentrating on, getting the staffing, so that these programs, these wonderful programs, and I know of a few myself, would come to the schools and actually start educating the children that there are other ways to deal with their the way they might be feeling versus a drug issue. So that's what I think. So I'm very excited to see that this is happening.
Right, I think the organizations will be really excited to have the opportunity, because I think, you know, on the one hand, we want to be very clear what our priorities are, but we don't want to put so many parameters around them that we're sort of driving the bus on this and saying, this is the kind of program that we want to fund. And what we're saying is, this is the need that we believe needs to be addressed. Those providers are the experts on what's the best way to meet those needs. So be it school-based program, after-school program, more psychiatrists at the federally qualified health centers, like, you know, more bilingual school social workers. We really want the agencies to come to us and say, based on the data that we have, here's the need, here's what we believe is the best model to address that need, and here's what it's going to cost.
Going along with what we were saying is parent education. So what we're also, that was another thing that came out of our exploration, is that parent education, parents understanding what to be looking for with kids that have mental health issues or substance abuse. We think a lot of parents know, because a lot of us have been around and we've seen this, but some of the parents that really need to know just aren't connected. They don't know.
Right. So the prevention side, I think, is absolutely, you know, a focus area, as well as the sort of the active treatment.
Right.
And I agree with you. My concern is that there are some households that will not have parents that even care. And so that's why I don't want to focus, because I've talked to some school administration, and they kind of put that on the parents. And well, for those kids that have that opportunity, great, but there's many that don't.
No, I agree. It has to be the schools.
Yeah, I just kind of want to weigh in here as well. I mean, I really like, Mary, what you lined out as food insecurity, housing, and behavioral health, mental health, especially the mental health thing. I mean, I see it as such a gap in our community. I think we've all seen some pretty sad stories go on, especially in the past year and a half. I mean, are we prepared as a committee to kind of have a consensus of these three? And I respect the childcare thing. We can keep talking on that.
That's fine with me.
But are we feeling pretty comfortable with these three?
What was it? The mental health, the food, and
Food insecurity, housing instability, and then behavioral mental health, substance abuse.
so absolutely. Though as this gets brought in front of the board, I can see multiple suggestions. So it's just my thought, and I probably should talk to called you and talked to you about this, but $10 million over 5 years, you can do a lot of really good. Is it worthwhile at all to take a portion of that, maybe a very small portion of that, a tenth of it or something, and use it for various other programs while spending the majority on these three things? Things like, remember Selman brought up, I'm sure, we'll hear some things from some other board members. And this is just me asking, I'm not saying I agree with that, but just what's your thoughts?
I guess sort of two things. The first thing is, there's nothing that says you can't set some sort of timeline by which you reevaluate the priorities. So I would suggest this is a 5-year horizon. In the middle of year 2.5, you kind of say, all right, is this working? Is there a different, has food insecurity kind of calmed down and we can really focus somewhere else? So that's what I would approach. And the reason that I would kind of push back a little bit on saying, well, let's put a little bit over here. Those of you who were around when the Human Services Grant Fund discussions would come around, I have concerns when you start really giving out lots of small grants, because you really can't make an argument that you're having a significant impact. And given the expectation and I wouldn't want to miss this incredible opportunity to make significant investments in some really core areas. And because the more, from the foundation's perspective, those small grants are just as much work as the large ones. And you just don't get the impact.
Gotcha. Thank you for answering that.
So that's what I was going to say. Oh, excuse me. Do you want to go
One
ahead?
thing that, I'm sorry, The one thing is almost all of the issue areas, there's some component of mental health. So if you picked an area, you might there may be a case to be made for mental health, and you can apply that to the work you're doing. So I'm not saying that would get certain things funded, but it's a way for an organization that may not be what we think.
Gotcha, gotcha. Okay,
So,
good.
I'm sorry.
No, that was a good explanation. Thank you.
And to just emphasize what Mary said, we've been talking about this in CDC. Those smaller grants are very difficult staffing wise. It's the same amount of work, same amount of hours, right? To your point, and not as impactful. So we're looking for the biggest bang for our buck, basically, here in terms of impact. And then just, again, I just want to reiterate the connection between DuPage Foundation and the DuPage County Board is really important. And we really want to see that partnership develop with a lot of communication and work together. And this could be a really great future relationship if we can nurture this and work together.
Great, so are we feeling good on this consensus? I gotta say, I was very impressed at our finance discussion and our county board discussion. I think everybody was on the same page, backing up Mary and really kind of firing from all pistons, you know, and I think it was very helpful, and I'd like us to be the same when it comes to priorities. So, you know, if there's any issues, let's get them out right now. And okay. The other thing I wanted to say was, are we all comfortable with having Mary kind of be the appointed conduit, whatever person for the foundation? Okay.
Do you want me to leave the room?
Yeah, no.
Yeah, I think you're good. All right, great. Any other, are we?
We're good.
All right, great.
Thank you.
Well, thank you guys both so much. Do we have any old business? Remember, Vice Chair Schwarzy had something.
So I know we're all on board with this 2-1 system. What do we need to do to get this moving forward sooner than later? And I don't know who I'm asking, Mary, I guess.
Yeah, I think, is Gina, are you here? She was gonna come in.
Can I just, so my understanding is that there's a special call. The finance committee coming up, that's soon.
It was supposed to be before the first, but we're out of weeks.
Well, I think Nick's been trying to schedule it. What I'm hearing is possibly next Tuesday afternoon.
That's what I heard. No, 2:00, that's Tuesday.
Wish we would all hear.
I just heard that this morning at another meeting.
Yeah, I don't have specifics on the timing, but my understanding is that there will be, Gina, there will be a special call at which I think the board will be making some decisions about what are we absolutely moving forward on, what are we, so similar to the grant fund, I feel like that we sort of need that commitment from the board that says, yes, we're going to do this. And then, you know, then we apply to 211 Illinois, we get the approval there, we work out the contract with Addison Dispatch, we look at, you know, staffing and we create the positions that we need to create. So I think we're talking, I think we think from the word go, we're looking at somewhere between 4 and 9 months. The implementation probably around 6.
But we got to get that ball rolling, and that would be at the special call meeting, it sounds like.
I think so. Yeah, once we have the total thumbs up from the board, then we can proceed with all the agreements and that kind of work.
Very good, thank you.
And thanks for bringing that up, Member Schwarzy. I mean, I had an incident a couple of weeks ago. I was working in the community kitchen, and I had a woman on the weekend who needed help. And I mean, who do you call during the weekend? We could not get help from anybody. She had nowhere to go. She was, I mean, she needed like help, like family services, because somebody was supposedly coming after her. I don't know if it was a mental health issue or not. But I mean, we tried the police, we tried family shelters, and TADS is closed. So it's just, to me, it's like, who can you call on the weekend when something like that's going on? So that would be the 211
That
number
would be
when
211.
that's up and going, right?
Right.
Okay. It needs to happen yesterday.
Bring that story up again next week,
I
please.
will.
I think Mary's been on this for a very long time, so. Yeah, remember.
Is Joan back in the room?
Yes.
Do we have a special call confirmed for next Tuesday? Because we were told it would be before the first.
Special call finance?
Yeah,
Yes,
and it'll be in the afternoon?
yes.
A long day. Why did we decide that?
That's what I was told to put on the agenda.
All right.
You might want to talk to member,
All right.
we decided to go in the afternoon for special call finance.
It's just
If
really, we have
there's-
a
I mean,
really
if
hard
there's
time
a-
with quorum in afternoons. That's my issue after a full day
I
like that.
work at the leisure of the board. You all- I think the thinking had been that by the time we finish county board, we'll probably be at 12:30. And then in order to give people a lunch break and then come back.
Yeah.
So, I mean, you all have to, you know,
Yeah.
I can't change the length of the county
No,
board,
no.
meeting, you know, so.
Talk fast.
I'm happy to do whatever works for you all.
All right,
And we did get actually also we did get a request like we for a legislative meeting as well.
At 1 o'clock.
Yeah.
Yeah, so maybe we should move the finance to a time we have to discuss it.
So, I mean, you all let me know what you want to do in terms of schedule. We originally planned finance special call at 2 and then had a request for legislative to come in earlier.
okay, any other old business? All right, any new business? Yes, Member Selman.
I want to briefly thank the committee for approving the extension for the Giving DuPage staff member. That new staff member has some video experience, so I wanted to highlight they are helping us put together a thank you video so that Giving DuPage can celebrate Lollapalooza, which is this October 28th. Like all of their events, it's virtual. We've had dozens of nominees, volunteers throughout the county who their organizations or neighbors want to nominate them and have them recognized for their volunteer work in the last year. It'll be a really interesting event. So thank you for your support on that position. It helps us make these really exciting events possible.
October 28th.
October 28th. Mhm.
Great, any other new business? All right, I'll take a motion to adjourn.
So moved.
All in favor?
Aye.